kala-azar, with all its effects, you know, as a very dangerous infection, all the people who live in an endemic area are at risk of falling sick. So maybe those, apart from the ones whom we pick out as sick, even the ones who are living there, because it is transmitted by a vector. Well, so long as that sandfly is within that community, and there are some people who are infected, everybody else is at risk of infection. So what happens is that we are, as a country, we have decided to put in more effort to fight this disease, and we have already started seeing a lot of success. However, yeah, because we have, we actually have, we have this disease occurring around border points like Kenya, Ethiopia, Kenya, South Sudan, Kenya, Uganda, you know, you'll realize that if the same effort is not being put in by the neighboring country, the sandflies will keep on transmitting the disease from the neighboring countries to our country, the people within our country. So the problem becomes that our efforts will go to waste. So what has happened is that the research community has developed a platform which is called the Leishmaniasis East African Platform, where the research is being done, joint research is being done across the region. And we are now picking up on that, where we are having a regional initiative to be able to try and see if we can be able to implement a common strategy as a region. The idea of being able to have a regional strategy, it is an idea that we have been fronting as Kenya, because we see that already we have a lot of plans. We are already steps ahead, and we wouldn't want our efforts to be diluted by reinfection from the neighboring countries. So we are appealing, we have actually appealed to the neighboring countries, that is Uganda, South Sudan, Ethiopia, Somalia, to also be able to come up with a strategy that is going to go in tandem with ours, so that even as we control on our side, we should also be able to see a similar kind of movement on the other side of the border as well. This meeting, this regional meeting that we have just had, it actually took place between in June, between the 12th and the 14th of June, 3 days in Nairobi, and we were able to discuss quite a bit in terms of how to craft a regional strategy towards control of these diseases. And we also looked at the possibility, mechanisms of being able to mobilize resources which can be used to reach individuals who require these treatments, because the treatments are quite expensive, and those are outcomes that we have been able to see during this meeting. We've also been able to see how we can have better coordination towards control of visceral leishmaniasis, that is kala-azar. We've also talked about better data management, because we want to be able to capture as many people as possible. We want to report the cases so that we can be able to get better funding and better support towards interventions of this disease. So we have had a very fruitful meeting during this period, and we hope that the recommendations that have been reached are going to help us as a country